Good afternoon. Welcome to the Thurston County Board of Health meeting for July 13th, 2021. It's 4 o'clock. My name is Ty Menser, Chair of the Board of Health. To my left is Commissioner Gary Edwards, and we expect our Vice Chair, Commissioner Mejia, to join us virtually any moment. We have the administrator for the Board of Health is our Director of Public Health and Social Services, Shelley Slaughter, who's participating virtually. Our clerk of the Board of Health is Amy Davis, and she's here, as well as our acting county manager today is Josh Cummings from Community Planning and Economic Development. I also see our county health officer, Dr. Dimiana Abdelmalik, and environmental health director, Art Starry. So let's call this meeting to order. We're getting a slightly late start, but not too bad, given that we just finished a board meeting and 2 public hearings, so I'm feeling pretty good about that. Is there a motion regarding approval of today's agenda?
I would so move.
Okay, I'll second that. Moved and seconded the approval of today's agenda. Call for the vote.
Commissioner Edwards?
Aye.
Commissioner Menzer?
Aye. That motion carries 2-0. Is there a motion regarding board meeting minutes from May 11th?
Yes, sir. I would move to approve the meeting minutes from May 11th, 2021.
I'll second that. And being moved and seconded, call for the vote.
Commissioner Edwards?
Aye.
Commissioner Menzer?
Aye. Motion carries 2-0. Board meeting minutes approved from May 11th, 2021. Next is the opportunity for the public to address the board. Oh yeah. Turn her on there.
Okay, I think I'll just clarify the last 2 motions, one for approving the agenda and one for approving the meeting minutes from May 11th, 2021 were made, seconded, and voted on 2-0.
Yep, I was a second on each, and Commissioner Menzer and Edwards voted yay for both of those. Item 2 is opportunity for the public to address the Board of Health. And I'm not going to go through the spiel unless there's a commenter. There's nobody in the boardroom and nobody on the Zoom. So with that, we're going to just move past that item and go straight to department item 3, resolution for appointment of alternate health officers. And Shelley, I'll let you introduce this topic.
Thank you so much, Mr. Chair, and good afternoon, Commissioners and Board of Health. This is a request for the Board of Health to approve Resolution H3 2021. This is a resolution to request the temporary appointment of alternate local health officers to serve and act in the event that our primary appointed local health officer, Dr. Dimiana Abdelmalik, who is here with you today, is unable to serve due to emergency, incapacitation, illness, or absence. This is typically an annual action that the Board of Health takes. However, this resolution proposes that it will remain in effect until revoked. It authorizes individuals such as Dr. Dimiana Abdelmalik, myself as your administrator of the Board of Health, your chair of the Board of Health, and your county manager to temporarily appoint an acting health officer in the event Dr. Dimiana Abdelmalik is unable to serve for a period of 30 days. This supports the community and the board in having continuous health officer coverage. And with that, I will answer any questions that you may have. Oh, I may also point out that this action proposes that any qualified local health officer currently acting as a health officer in the state of Washington, and also Dr. Diana Yu, who is a former retired health officer representing Thurston County, currently meets all qualifications, would be able to serve in this capacity should this be needed. And this will support our local health officer in being able to take much deserved annual leave as needed after a very trying year supporting all of us during this pandemic. And now with that, I will ask for any questions that you may have prior to authorizing this resolution or not.
Start with Commissioner Edwards.
I guess the only thing I'd say, we're going to extend this until What's the date again? You're extending it until it's revoked? Is that the way we're putting it?
This resolution before you, should you approve it today, would remain in effect until you amend or revoke this.
Okay, and my question was this going to be extended until it is revoked? And Shelley stated in the affirmative. I didn't have my mic on. Okay, thank you for that answer, ma'am.
Thank you.
Commissioner Mejia?
No questions. Thank you.
Shelley, so if I understand this, Dr. Yu is the alternate for every purpose? Because I know when we didn't have a health officer, we had alternates split into, we had sort of the different disciplines kind of split, and we had multiple alternates, but this is kind of an across the board backup. Am I understanding that correctly?
That is correct, Commissioner Menzer. This would authorize Dr. Diana Yu to serve in the capacity of health officer or any other qualified health officer per the state of Washington in accordance with RCW 75050050.
Okay.
That's per section 3 of this resolution, is that right?
Any qualified acting health officer who meets the qualifications set forth is hereby authorized to act as health officer and shall have the same duties as though appointed.
That's correct. Typically in the state of Washington, there are multiple local health officers in local health jurisdictions, districts, and counties that are empowered by the Secretary of Health, the state of Washington, and this statute to act in the capacity of health officer. So this would allow any other health officer to provide mutual aid or coverage to our county, which is typically exercised by counties throughout the state of Washington. In addition, in this case, we are requesting to add Dr. Diana Yu. While she is not a current health officer serving in another county in the state of Washington, she does currently meet the provisions, is familiar with Thurston County, and is able to meet the qualifications should she wish to serve. If she was not able to serve in temporary capacity, any other health officer in the state of Washington could as well. This is beneficial both in the event, like I suggested, where Dr. Abdumalik may take a vacation, but it could also be in the event of some kind of disaster where our Thurston County health officer is unable to act and we're able to rely upon a nearby regional health officer or other health officer in the state of Washington and have no lapse in coverage for Thurston County residents.
Is there a decision-making tree? Like, let's say Dr. Abdumalik was incapacitated because of a disaster or something. Who would be would it be the Board of Health that would designate who would step into the role? Whether it's Dr. Yu or another county's health officer?
In this particular resolution, what we are requesting you to authorize today is for a succession order to be established that would include first Dr. Abdumalik, who could appoint her own substitute or successor in her absence or planned illness leave or unexpected incapacitation. The second would be myself as your appointed administrator of the Board of Health and director and the supervisor of our health officer. If I was unable to make such an appointment, then our county manager or assistant county manager would be authorized. The chair of the Board of Health, yourself, Commissioner Menzer, would be able to. Of course, the Board of Health as a sitting body would always be able to. So this provides a succession so that there would always be someone that could make such an appointment. In this particular case, we're asking that you pre-authorize a group of qualified health officers that may serve, so we don't have to call you to action every time Dr. Abdumalik may need to take a weekend off, for example, and we're able to temporarily have continuous coverage for Thurston County. But should that length of time ever exceed more than 30 days, then at your next regular Board of Health meeting, that would come before you as a individual appointment.
Okay, I think I got it. And then if she, absent an incapacity within 30 days, she can designate her coverage based on this group that we're authorizing, which includes Dr. Yu plus the other county's health officers.
Yes, that is correct.
Okay, that makes sense now that I understand it. Okay, any other questions from the board before I call for a motion on this item? No? Okay, is there a motion? Vice Chair?
Yes. 1 second. I would move to approve the resolution for the appointment of interim health officers.
I think it's alternate health officers, is what I've got on mine.
I have interim on mine.
Shelley, how should it be worded?
It should be alternate, sir.
Okay.
Alternate? Okay, so probably the one I got was not correct. So I would move to approve the resolution for the appointment of alternate health officers.
Second.
It's been moved and seconded. Any further discussion?
No, sir.
No, sir.
Call for the vote.
Commissioner Edwards,
Aye.
Commissioner Mejia,
Aye.
Commissioner Menzer,
Aye, motion carries. And that is approved. All right, item 4 is a department item, summer safety. And Sammy Berg is here, Senior Environmental Health Specialist. And this is an informational briefing for the public and commissioners. Go ahead, Sammy.
Hello, and thank you for giving me the opportunity to present to you. I'm going to cover quite a few things in kind of a high level of a couple of different slices of topics. So feel free, if you have a question, to go ahead and jump in and ask before we move too far down the road. And then the answers might get a little confusing depending on where we are in that presentation. So please just pop in and let me know if you have questions. I'm going to share my screen, and hopefully technology will work for us here. Let's see. And so hopefully you should now see my slide presentation with my entry slide. Is that up, folks?
Yep, perfect.
Okay. So away we go. We'll start off with but a lot of what people associate with summertime, which would basically be the outdoor eating, the picnics, the barbecues, potlucks and whatnot that make summer enjoyable and something that we all enjoy, as long as it's not hot enough to actually cook your food outside without a barbecue. We're done with that, hopefully, at least for this summer. So food safety, especially in the summertime, comes down to kind of 4 basic things: clean, separate, cook, and chill. Cleaning always means at least washing your hands before you do things like cook for others, before you touch raw meat, or after you touch raw meat, before you eat. Washing hands is always a good idea. We want to separate things by having, not using the same cutting board for the hamburger patties that you then use to chop up your vegetables for your salad or fruit. And so keeping stuff that's touched raw meats separate and from other items that you're going to use. Cooking means basically just using the appropriate temperature. You're going to want to make sure that your hamburger patties are at least up to 160 degrees, that your chicken is 165. The biggest thing we do say is that especially if you're grilling and doing barbecue stuff, that invest in a digital thermometer, because you can't always tell just based on the color if something's done, in particular with chicken. Then keep cool or chilled. Basically making sure that things that aren't hot are cold. You know, your watermelons, your pasta salads, and things like that. That they're cold, and so they don't have a chance to grow bacteria, which is generally what makes everyone sick. And so, and we'll go over to the next slide about coolers, and which is basically a couple of main points, which is make sure you have lots of ice. I've seen lots of people put some ice down as a bottom layer and then put all the food on top. But basically, unless the ice is actually surrounding all that food, all that cold is at the very bottom. And so you want the ice to be at or above the same level as all the food, because that's what's actually going to keep it cold. We also don't want to put ready to eat foods in the same cooler as raw meats. So if you have some raw meats, hamburger patties or whatever, you're going to take a picnic to cook elsewhere, you know, make sure that's in a separate cooler so that you don't inadvertently contaminate your soda pops floating in the ice, for example. Also, think of if you have that cooler full of soda pops and other things that are melting, and there's basically the big cooler full of water. As people use that over the day to reach in and grab their things, you're basically making a kind of a dirty hand soup out of what's in all that water in your cooler. So, you know, having clean hands certainly works to make that a better thing, but also, you know, making sure just to drain some of that water off occasionally, so you keep the ice and keep the cold, but you don't necessarily want that soup of dirty hand stuff. And just for coolers, also that cooler that you did put the raw meats in, make sure to wash and sanitize that when you're done, so that the next time you grab a cooler for a lunch or whatnot, you're not grabbing the cooler that's not been cleaned out. Okay, so that's the food safety side. We're going to switch to swimming. So just checking real quick, any questions on that?
No, sir.
Okay.
Go ahead,
All
Sammy.
right.
Yeah, we're good.
Okay, so swimming. It's again very hot. People are out wanting to do a lot of swimming and cooling off. Drowning, of course, is one of the major hazards associated with swimming. Unfortunately, more children die between the ages of 1 and 4 from drowning. More of them die of drowning than any other cause of death except for birth defects. It is, especially for that age of kids, once they get somewhat mobile and kind of walk on their own, then there's a lot of, you know, a body of water is very attractive to them, and without swim lessons, without fence around the pools, certainly without life jackets, and attentive adult supervision, which is a major key factor, then we do have, unfortunately, a large number of kids drowned across the country. We get kind of summaries of drowning reports across the country, and inevitably it's some combination of a lack of a barrier and a lack of attention by whoever's supervising them. And it doesn't take long before the child is now over into the pool, or over even at the neighbor's house into a pool, and tragedy strikes. And certainly we want to try to prevent that as much as possible, and we can have overlapping layers of protection through making sure that that they get swim lessons and have some protection that way, that there's some barrier protections around pools so that it's harder for them to, without attention, to wander into a pool or beach or whatnot. Life jackets, again, do a wonderful job. And then overall, that attentive adult supervision, all of those things can overlap to make a really safe and still enjoyable environment, and prevent those kinds of tragedies. And then moving on from drowning to another hazard in pools, which is certainly, this is a recent Centers for Disease Control poster, the green, with the thing about diarrhea. And basically just the idea of having, especially young children in diapers, in pools, and unfortunately sharing their feces with those that are in the pool. Primarily, we're worried about diarrhea, in particular because then it can essentially leak out around the diapers. versus an actual, just formed stool. And then also diarrhea tends to just imply that they are sick with something, and we certainly don't want that shared with the rest of the folks in the pool. So, don't take your kids or yourself into the pool if you have diarrhea, and for definitely for kids that are in diapers, to take them out every hour and go do a bathroom break. And then if they have to change diapers, do that not right on the pool deck. I know some parents get pretty blasé about my child needs a new diaper, and I'm just going to take care of it right where I'm at. And there are some places where that's not totally appropriate, and then trying to get that at least a little bit away from the pool deck might be appreciated by others from just a visual point of view, but also just from a safety view of not making sure we don't have any spread into the pool itself. We also want to remind folks that especially around at pools where you have shower facilities and whatnot, to take a shower real quick before you get into the pool. Not only does that help wash off anything on your bottom, but also it all helps wash off a lot of the oils and other things that are on your body that once you jump into a pool, then take away some of the active chlorine that's in that pool to help prevent and take care of the bacteria. And so if all that chlorine that's in the pool to keep it safe end up getting used to just clean essentially your body because you didn't take a shower beforehand, then there's just less of that for everyone else to be protected by. And that was one of the things that most people don't understand, is that the shower before the pool is not just a nicety. It really does help the pool maintain a higher and safer level of sanitizer to keep the water actually safe, not just clean. Okay, so that's for pools. And of course, now we move into beaches, and we have a number of lakes and marine beaches that the residents take full advantage of. Unfortunately, we've had a number of either bacterial or algal blooms that have resulted in beach closures recently, and as well as several years in the past. We do have a number of ways to look at those kinds of problems and to post those issues. And my next slide will show a number of websites that folks should look into before they go out to a beach, to help understand, is there any restrictions on the use of that beach? And primarily, if it does talk about, like in this case, showing a no swimming, we look at what's going on in the beach, and then we generally categorize it by use. So like, it may be that we don't want you swimming, but boating may be okay, or whatnot. So the signs will be pretty specific about the activity that we're saying don't do this because of this problem. And so please do follow those signs so that we keep you all safe and enjoying the things that are there. And especially because of the heat that we had 2 weeks ago, we definitely saw a number of beaches, not only in Thurston County, but throughout Puget Sound, closed due to high bacterial levels, as the bacteria, just like everything else in the water, just is more active and more readily reproducing as the temperature increases. So as I mentioned, there are a couple of different websites that people can go to look at water quality in natural water bodies, to see where they want to go and do some swimming or boating or harvesting or whatnot. And so we have the beach program. We have something that's swimming in Thurston County is specific to to Thurston County around algae. Nation or statewide, there's the Washington level, and then the State Department of Health has a recreational shellfish safety one for shellfish harvesting. Also, as was pointed out in the Olympian and other places, that the shellfish took a big hit because of the heat as well, because we had a lot of daytime low tides and a lot of exposed beach with very high temperatures, and they're still trying to assess the actual die-off of shellfish that occurred because of that heat, which is very unfortunate. And we'll have to see what that looks like in a couple months as those mature, and see how much shellfish might have been lost due to those exposures.
Sammy,
Moving on from,
hold on. Before you
Sure.
jump off of lakes and swimming and boats, my son asked me a question I could not recall the answer. It was, if you are driving, do you need a license to drive a speedboat? And what kind of license would that be?
I know that there are, I'd have to say I'm not sure. I know
Yes.
that you can get a license for a boat. I don't have a boat, so I'm not sure where
Can
that
I answer that
criteria
one?
fits in. Art, do you have?
Yeah, you have to have a boater safety card.
Okay.
So, and you can get that through the state, but you do have to show that you're trained in order to take a power boat.
I knew there had to be something, but I wasn't sure. All right, thanks.
Yeah, you can, Department of, or state parks, you can go to their website and they'll have information for you on that, but that's something you need to have. There's different ways to meet that criteria though.
Okay, thank you. Go ahead.
I contributed to this presentation, yay.
And I do believe that's not strictly like 16 and up kind of thing. There's probably a lower age limit, but I think it's more, I think kids can get it easier than obviously like a driver's license. So, but something to look into, definitely. So now we're gonna move into rabies and bats. Just as an example, between Sunday and Monday, I took 6 different calls about various bat exposures in Thurston County. And during the summertime, we tend to get more of these calls as we get that combination of bats being very active, but also longer evening hours and more open windows as people were trying to cool off. And some of those windows don't have screens, or they may have opened the doors to try to create more cross breeze going on, especially as the day turns into night, and there's more opportunities for bats to then fly in and have interactions with people. The main thing, we love bats. Bats eat generally just shy of their body weight in insects every day, so they do a great service for us. We just don't want them in our homes where they might then have interactions with people directly. So we definitely want to keep them out, and screens work great to do that. Another way to provide kind of a buffer between bats and other wild animals is to keep your pets vaccinated. That is state law, but in particular, we definitely want to make sure cats stay vaccinated because of the potential bat exposure. Bats are the only animals in Washington State, only wild animals that generally carry rabies. All mammals can get it, but in Washington State, we're fortunate enough that really it's only in the bat populations. We don't see rabies in skunk, fox, coyotes, raccoons in Washington State because of probably like the Columbia River and some of the mountains on the Idaho side. Rabies in those animals has not crossed over to us, and it makes our jobs a lot easier to only be worried about bats. But because of that, then for a pet perspective, we really are concerned about cats, making sure that they're vaccinated, because they do love to catch bats and bring them home as presents to people and cause problems that way. Dogs, of course, yes, we do want them vaccinated. And if we do get a bite report, hey, I got bit by something, primarily it's a dog. So reasons to make sure both of them are vaccinated, along with, of course, just the law saying that that's why that we do need these done, is to protect the public from these concerns. Just a few weeks ago, we did find a live bat on the ground at an apartment complex, and there were a number of kids that were around that bat, kind of poking at it with sticks. Unfortunately, an adult saw what was going on and basically captured the bat and talked to the kids about, did anyone touch the bat? And we then tested the bat. Fortunately, the bat came back negative. There's no signs of rabies, which is great, but there could have easily been an exposure of a number of kids in that situation. And so we just want to make sure we remind folks to talk to your children about, bats are great, but if you see one on the ground or if there's, just to not touch it and to go get an adult, because we want to avoid any direct interactions with them from that perspective. About 6% of the bats that we test in Washington State are positive for rabies. It's a relatively small number, but since rabies is fatal, we want to be very conservative about it. And we want to make sure that we are able to do our best to confirm that there's been no connection, no exposure, no direct skin contact between a bat and you and your family. And so,
Sammy, do you want to go to your next slide?
oh, yeah. So these are kind of the things that we can talk about. It's basically, it's like, keep them vaccinated, keep the pets vaccinated, keep the bats out of your house. Don't touch the bats. And if you do find a bat in your house, try to contain it, but call us, because ideally we want to understand, has there been any kind of potential connection between that bat and you and your family? If there has, we would much rather be able to test the bat to make sure we don't have a problem. Because if we don't have a bat to test, we have to presume that it was positive, because we're being, again, very conservative. We want to make sure we have no problems with rabies with humans. And that means that if we can't rule it out, then we're going to make suggestions for people to get the only protection that is for rabies, which is a rabies vaccine. There's no medicine to cure it, but we can prevent it. And the vaccine is very effective for prevention, but we'd much rather test the bat and show that it didn't have rabies in the first place, so therefore your family doesn't need the vaccine. But if the bat's in your house and then you let it go, we can't have that conversation because we don't have the bat to test. So we'd rather get that call at 2 o'clock in the morning saying, hey, we found a bat in our house and we closed it in a bedroom. And so what do we do next? And then we can have that conversation, and we can hopefully give you some guidance about, okay, here's what we can do. We are available after hours through the 911 dispatch and over weekends. And we'd much rather get that call in the middle of the night and find out about things and help you through that conversation, rather than hearing about it in the morning after you said, and then I let the bat go. So let's prevent the bats from getting in the house in the first place, screen windows, close doors as much as possible and whatnot. But if there is a bat in your house, we do want to hear about it, hopefully while the bat's still available or contained in some way. We can figure out how to make the rest of that work. We get about 100 bite reports and bat reports every year. The majority of them don't have a whole lot of concern, but we'd much rather hear about it and let you know that we don't have a concern than to hear about a problem afterwards. And so feel free to give us a call. You're not bothering us in any way. We want to hear from you. So that's bats and rabies. And we're going to move on to other summer exposures, which is more sun and biting bugs, and they aren't really connected, but one of the solutions is basically a spray. And so I kind of put them together. So the idea of covering up, limiting your time of exposure, and then slathering up, kind of cover both sun exposures and biting bugs. The less skin you expose for either one is good. Less potential you're going to get a sunburn or stung. Limiting your time, depending on what risk you're looking for. Dusk is a great time to go out and not get sunburned, but it's not a good time to avoid mosquitoes. So kind of have to pick and choose what you're trying to avoid. And then also use appropriate either sunscreen or bug spray to provide you with some added protection. Fortunately, in Washington State and in Western Washington, primarily we're talking about mosquitoes as the insect to avoid, so we avoid various diseases and just irritating itchy bumps. And they're on that EPA website. There's a number of effective bug spray and ingredients listed that help you choose to make those choices. But certainly, if you're going more into the woods and whatnot, then there's potential for ticks, even in Western Washington. So be mindful of ticks as well. And there is more information on our website about all those kinds of critters.
I got a question on sun exposure.
Yeah.
So you say 10 to 2 p.m. is peak time exposure, and that'd be true for where I grew up in Southern California, but in Washington, the hottest part of the day usually seems like 4 to 6 p.m. Does that mean the sun is still stronger in the morning, even though it's hotter later in the day?
So it's a great question. the skin exposure, the 10 to 2 is when the sun is going to be the highest at the most overhead. And so that's when you get the most direct ray exposure from the sun. That exposure really is not connected to the air temperature.
Okay.
So, so even if it's, say, if we had so like when it was really hot outside in the, in the 108 degree, the air temperature increased quite a bit. The sun exposure was not more or less, it's just what it was. So, it could be that we have a partially cloudy day or a hazy day. You're still getting quite a bit of sun exposure, but it's relatively cool. So the two are not directly connected. So it could be a very hot evening, but if the sun is it's evening because the sun's lower in the sky. So you're more likely to get more shade and less of that direct sun just beating on you. So it may still be really hot, but your sun exposure is less. So they are two kind of separate things. Does that make sense?
Yeah, it's good to know. So
Okay.
stay out, even if it's hot, I still want to limit exposure in the middle of the day. Even
Yeah,
even if it's cooler.
Yeah, and then certainly we'll talk more about heat in and of itself as a hazard in just a couple slides. So we'll talk more about that.
All right.
Okay, so summer crashes, and these can be from a variety of things, from skin knees off of scooters or motor vehicle accidents. Of course, motor vehicle accidents are a particular concern in just that it's a big heavy metal thing moving at speed, and whenever that stops moving suddenly or runs into something else, you're just going to have a lot more energy to cause injuries, unfortunately. Looking in Washington State data for 2019 was the last year we've got complete data for, but there were a number of fatalities in Washington State, and the state is looking to really try to reduce that, which is good practice, certainly. There were 1,000 plus deaths related to people who were unrestrained. So adults not wearing seatbelts, children not in appropriate child seats. And that just goes back to what we've known for decades, that a body that is not appropriately restrained within the car is very likely to be hurt and or killed as a result of an injury. For instance, for Thurston County, that relates to about half of the 21 fatalities we had in 2019 were unrestrained passengers or drivers. And that's such an easy fix. The seat belts, the child seats is they're very effective doing what they're doing, but we need to use them. We also need to try to not drive in an impaired fashion, and whether or not that's impaired by drugs or alcohol or inattention. All of those then factor into also resulting in accidents and crashes. And across Washington, again, for that 2019, there were about 9,000 alcohol-related impaired driving circumstances. And again, those are, so focusing on, if you drink, then don't drive, or have a designated driver, use, shared, Uber, Lyft, taxi, walk, ride a horse, do something else besides get behind the wheel and drive. And also, and talking about like the kids with the helmets, we are looking at about half of the brain injuries in children that come through emergency rooms are a result of a fall. And helmets can do a very effective job in keeping their noggins, all the innards in their noggins right where they belong, and keeping them from getting too scratched up, banged up, or whatnot. And whether or not they're, like in this picture, scooting around, biking around, or whatnot, but also if your child's involved with sports and using appropriate headwear for those sports, especially if there's contact involved, like football, or wearing a batter's helmet for baseball or things like that. There's definitely lots of good evidence to show that helmets can reduce the reduction of head and brain injury by anywhere from 60 to 80%. And so it's easy to put on, and they provide very effective protection. But part of that too is that your child is much likely to continue to wear their helmet if they see you do it as well. So, leading by example also can lead to them getting into the habit of wearing the helmet even when you're not necessarily around. I have personally just seen plenty of kids on bikes with their helmets, but the helmet is, hanging by its strap on their handlebars because their parents obviously said, "Don't forget your helmet." And then they rode off, and then the kid took the helmet off and put it on the handlebars. And it's just so unfortunate to see that as a potential instead of having it on their head and protecting them. Wildfires. So obviously, with a lot of heat comes a lot of potential for wildfires. We've already seen some minor fires in Thurston County. We've certainly seen some going on in Eastern Washington. And there's the direct fire hazard, but as we saw the last couple of years, there's the indirect states away fire hazard that then comes in from a smoke perspective. And so people are far more likely in Thurston County to be impacted by smoke from other parts of the state or even from out-of-state fires. And much like with heat concerns, basically it stresses your system. So whatever you can do to put less stress on your system by limiting your physical activity, by staying hydrated, and just trying to limit your time outdoors if you can, to reduce that stress, since you're breathing in all that smoke and you're challenging your body without doing anything. There are a number of websites where you can check whether or not smoke is in the area or what's going on in that. WASmokeblogsport.com is one of the better ones that is for Washington, and it provides a lot of good information and can help you understand what's here or what's coming and kind of anticipate things.
Hey, Sammy, would 5 minutes or so be enough to wrap up?
Easily, yep.
Perfect.
Yep, I do. So then we get into hot weather, and much like we were saying, that heat is just going to be another stress on your body, and so staying hydrated, avoiding things like caffeine and alcohol, which result in your body trying to get rid of water, and you want to suck it in, hopefully have it sweat out. If that's what's going to provide you with some cooling. Wear clothing that's not going to be too hot. Now is not the time to when it's too hot outside to get on your suit of armor and go play nights in the sun at a Renaissance fair. Especially young children and pets in vehicles heat up very quickly. We want to certainly avoid problems with that. Take frequent breaks. And certainly those who are elderly and without AC, do what you can to try to check in on your neighbors, check on your loved ones, and make sure they are doing these steps, and whether or not they need to actually be in a cooler environment. We all saw that in Thurston County and across the state, there are a number of fatalities associated with the high heat, and anything we can do to make sure that people are given what relief they can to prevent that would be good. There are a number of things that could come up, like all we've talked about, and there is a way for county residents to sign up for emergency notifications that could cover things like the high heat event and where cooling locations might be, or the next winter storm, wind events, whatnot. But you can follow this Thurston County WA.gov page and sign up for the emergency alerts, and they could get a text message about something that's upcoming and hopefully provide more information. Includes also burn bans, boil water notices if there's an issue with a particular neighborhood's water systems, missing persons, chemical spills, or whatnot. One more thing to just briefly wrap up is COVID is still here. We're certainly looking much better than we were months ago. Vaccinations are really doing some good benefits to us. So So one of the things we certainly want to promote is if you're not vaccinated yet, please do so. The unvaccinated are basically the majority of those who we're seeing be most severely impacted or in the hospital. We do still see spread going throughout the county, although those numbers are lower, and that's good. But that will continue to fluctuate. We still need to pay attention. We still need to not just freely go about our business. We do need to try to reduce overall gatherings and whatnot. Wear a mask indoors if you're not fully vaccinated. Vaccinates are still free. They're available for those 12 and older. There's a website for Thurston County where they can go to find out where the county's providing vaccinations or the pharmacies are. We also have a page with just current vaccine information. One of the things that's also being highlighted is that at this point, certain businesses and facilities are still requiring masks of everyone, regardless of vaccination status. And in this case, medical facilities, schools, K through 12, there's a number of other places where, regardless of the vaccine status, people have to wear masks. Basically, and this is something that DOH has put out, which I like the idea of, just respect the rules of the room. If there's a sign that says, hey, we want everyone to wear a mask, then wear a mask. You're kind of in their home, and please follow their rules. If they ask you to take your shoes off, you would follow their rules. So masking is kind of along those lines of how we're trying to all support each other in this. But also, if you're going to hold a big gathering, is now the right time to do that, or kind of make it limited in the number of people you're inviting over? Is everyone that's coming over vaccinated? Let's have that conversation. I think it's a good one to have. If someone comes that's not vaccinated and is wearing a mask, how do we make sure they feel comfortable in still doing that and wearing that mask so that the rest of us can all still interact with them without them feeling stigmatized or too self-conscious? Because we'd much rather them be protected and still wear that mask and not feel like, well, no one else has it, so let me just take this off and remove that protection. So there's still lots of conversations to be had with amongst ourselves, and primarily, though it's not gone, but we are making really good progress. The vaccines are key to that, and promoting folks to get vaccinated is still our job number one. So that is the end of my presentation. And I'd be more than happy to answer any questions you may have, but thank you for your time.
Thanks, Sammy. Lots covered. Lots of good information there. Commissioner Edwards, anything?
No, sir. Thank you.
Commissioner Mejia? You're muted, Commissioner Mejia.
You missed my whole spiel.
Yeah.
No.
Saw the hands. That was good.
There.
Gestures were good.
I was talking with the hands. No, I was just wondering if this communication is being disseminated out to the public in some way or another.
We did put this together pretty quickly to fill up the available time at this point with you guys. We'd be more than happy to work with our PIOs to take parts of this and put it out and make some messages. It's basically we gathered some of the existing messages we already had, but we can certainly make sure that overall we're still pushing that information out to the public.
Yeah, that'll be great. Thank you.
Okay, you're welcome.
All right, good. Thank you, Sammy.
Okay, thank you all.
Let's move to item 5, Board of Health members, health-related activities and accomplishments. Commissioner Edwards, anything you wanted to report on?
No, not really. Just ongoing questions about the virus from the public. They're continuous and ongoing, but really nothing substantial to report on that.
Commissioner Mejia?
Kind of same as Commissioner Edwards. New questions about the virus and specifically the new booster shot that came out, as well as questions in regards to Black Lake especially. I think I've gotten a lot of questions about that one.
Okay. I guess the only thing I would report is had a chance to attend pieces of the State Behavioral Health Conference a couple weeks ago online. There are all sorts of breakout rooms and tracks, and I focused on the criminal justice stuff because that's just kind of what I'm interested in. And the city of Olympia was able to present some of the things they're doing with their programs to the state, which I thought was cool. And there was some good information about some programs in the east side of the county that are starting to spring up, very similar to what we're doing here in Thurston County and in Olympia with diversions and a kind of a crisis response teams that are going out. And we know that's happening in Snohomish and Kitsap and other places. So then there's some new legislation that should give that a boost, requiring communities to have behavioral health navigators. So that's all good movement, and that was a good conference. That's my report. Let's go to the health officer's report. Item 6, Dr. Abdulmalik, haven't seen you in a little while. How are you doing? And we're ready for your report.
Good evening, commissioners. Thank you so much for giving me the opportunity to report to you today. I wanted to start out with a brief COVID update, just because I know you're getting so many questions. We are here in Thurston County seeing a bit of an uptick in cases. So this past week, ending on July 11th, we had 134 cases compared to 101 cases the week prior. Some of this is likely due to the reopening, and some of this may be due to 4th of July gatherings, which we saw last year. And we're still looking at the impact of the Delta variant, which is more transmissible. As well as other variants that are circulating in our state, as well as our county. This past week, we saw about 26% of our cases were in the 30 to 39 age group. And then the next highest bracket, or 26 cases, were in those under 19 years of age. So we are seeing, so a lot of the cases that we're seeing are skewing younger. This really reinforces the need for everyone who hasn't been fully vaccinated, meaning 2 weeks after their final dose of a COVID-19 vaccine series, either 1 shot of J&J or 2 shots of Pfizer or Moderna, to wear masks in public indoor spaces or crowded areas, and maintain that 6 feet of distance where possible between themselves and non-household members. While we are making strides, we are seeing that uptick in COVID-19 activity, which we're following closely. I did want to update you on the variants. To date, we still only have one sample taken from a Thurston County resident that was positive for the Delta variant. We've had more than 100 of the Alpha variant, which is the UK variant, the B117 variant, 4 from the South African variant, so the B1351 variant, and 6 from the P1 or Gamma variant, which originated in Brazil. The Washington State Department of Health updates this weekly, and we're expecting this week's update to come out in a few days. So we do continue to make strides in terms of vaccination. To date, 152,583 Thurston County residents have initiated vaccine. That's about 52.4% of our total population, or 62.5% of our population over 16. So we're definitely making strides. Additionally, 139,982 Thurston County residents are fully vaccinated, meaning that they've completed a full series. So that's about 48.1% of our population, or 57.6% of our over 16 population. So that's always good to see, and it's just a reminder that as we protect ourselves from getting COVID-19, we reduce the ability for variants to emerge, because variants emerge when a lot of people are getting sick. So I know that there have been concerns or thoughts about a potential booster At this point, the CDC and the FDA are not do not have data that supports the need for an additional booster here in the U.S. And we do have some evidence that all of the currently FDA-approved vaccines that are being used have activity against the variants, including the Delta variant. I know that other countries are starting to think about boosters, and I anticipate we will be hearing a lot more about that as time goes on. I did want to update you on some things that weren't COVID. So in terms of our disease control and prevention team, we've followed up 71 confirmed and suspected cases of a wide range of communicable illnesses, ranging from Campylobacter to hepatitis A, B, and D, as well as highly antibiotic-resistant organisms, Q fever, salmonella, Shigella, syphilis, and Vibrio, among several others. We also continue to provide active care for TB patients, in addition to consulting with other providers throughout our county on tuberculosis. I did want to take a moment just to chat a little bit about the swimming advisory that remains in place at Burfoot Park. This is a swimming advisory that is in place due to a high level of E. coli bacteria.
Dr. Abdulmalik, I'm sorry to interrupt you. We lost Vice Chair Mejia, and I'm wondering if we want to give her 30 seconds, she'll probably be zooming back in. And then if not, we'll let you pick right back up. But a lot of times when you get dropped, it's just a matter of finding the link and clicking it back.
Thank you so much, Commissioner.
She's connecting, and
I'm back.
you're back. Okay, I stopped Dr. Abdulmalik, so pick it back up, Dr.
Okay,
Abdulmalik.
thank you.
Yep.
I will have my video off just in case. I'm not sure if having the video on is just overloading them.
Sounds good. Go ahead, Doctor.
Thank you. So I just wanted to take a few minutes and chat about the swimming advisory that remains in place for Burfoot Park due to high E. coli counts. These E. coli counts are downtrending. We sample weekly, but they're still above the advisory level. So we're really asking the public not to have direct contact with the water just due to risk of infection, among other things. And I'm looking forward to the time when the E. coli level at Burfoot dips below the advisory level and activity can safely resume. And with that, I am open to any questions you may have. Thank you so much.
Commissioner Edwards?
The one thing I'd ask, and I know we're not supposed to be asking about individuals, but about a week ago, we had a notice that a young person had succumbed to this, and there was some question if it was this new virus strain. And there was never a follow-up that I saw. So did we ever determine what that death was about? I want to say the person was in their early 30s.
So we do protect folks' privacy and don't comment on individual cases. We have seen mortality in younger folks recently as well. So when that happens, what we do as a health department is we try to track down the COVID-19. So this would be a death in a young person under 40. That was attributed by the healthcare providers to COVID-19. And what we do is we track down the sample that was taken. And if it's possible and if the sample is still viable, then we try to send it for sequencing to try to answer that exact question.
But we don't know yet, though, if it was one of the variants that are of concern. Is that what I'm hearing?
So we wouldn't we wouldn't be able to share that information
Okay.
at this point, just due to
Okay, enough
privacy.
said. That's fine. I knew there would be some rule in the way.
Commissioner Mejia, anything for the Dr. Abdulmalik?
Not at this time, thank you.
I had a question of whether or not do we know at this point, like out of all of the people who have contracted COVID-19, this is just ballpark obviously, but what percentage of those people show symptoms or show a symptom enough that they would, catch their attention, they go get tested versus, is it 1/3 or 1/2 or 2/3 versus folks that get it, never knew they had it other than they got tested for some other reason? Like, I mean, we should have enough data now to have a sense of that, right?
Yes, but it's a tricky question to answer because there's so many, as we're learning, there's so many different factors that affect folks, that affect folks' decision to get tested. So a lot of what we're seeing is that the majority of folks, and this is based on my current understanding, that a majority of folks will have a symptom associated with COVID. Sometimes though, sometimes folks will have allergies or asthma or any one of a number of other conditions that might make it hard to recognize COVID symptoms. Sometimes, COVID presents with a sore throat and a fever that, that doesn't last. There's so many different ways that it presents. And that's where a lot of that uncertainty is.
Yeah.
So the majority of folks, when we look back, have had symptoms, but due to that variability, it's hard to get an exact number.
The reason I ask is, I guess we've gone through a year of like these daily updates. Okay, 24 cases, 78 cases, 100 cases, 11 cases. And I'm trying to figure out how much stock to put in those trending numbers, given what you just said it. You said there are so many variables that contribute to whether someone decides to go get tested. That's what's always kind of confused me. Like, I've always assumed that to be true. We're not out making everyone get a test every day. Then you'd know, right? You'd know exactly where it is in your community. But we're relying on this self-testing or recommendation to test, and those numbers. I remember I asked early on, I mean, if we're comparing every single day as if it's like apples to apples to apples to apples, I can imagine on Sundays, people are out of town and they might feel something, but they're not going to get tested till Monday because they don't have the opportunity. I mean, so I just wonder about, like we seem like we watch these case counts, but at this point in the pandemic, it seems like I would imagine that those variables that cause people to get tested or not have shifted around a fair bit between vaccinations and, people thinking wrongly, but people assuming, oh, we're kind of behind it, it's kind of behind us now, or oh, it's not as deadly as maybe I feared because, we've had a year's worth of seeing how dangerous it is or not. I don't know. I just try to get a sense of those numbers and kind of how much is it really apples to apples at this point. If we think back to, oh, well, a year ago we had 100 cases a day and now we have 11. Well, is it really this? Is that comparable? Because we're testing the same people that we would have tested last summer. I think people were a lot more freaked out last summer in a sense because we didn't know where the trends were going, where we were headed. And I think everybody I knew was going to get a test at the slightest notion that they didn't feel very well or whatever. And I don't feel like that's the case now. So I don't know. Do you have any comment on any of that, just to kind of give me some clarity there?
Yeah, I think that you make a great point about the need for folks that are symptomatic to get tested, regardless of vaccination status, and I continue to recommend that. The other thing that gives us a little bit of a clue as to the overall prevalence is the percent positivity.
Right.
And our percent positivity is around 4% now, which is lower than it was in months past. And so that tells us a little bit about how prevalent COVID-19 is amongst those who get tested who have symptoms. So that's a good number that kind of provides that backstop. So when we were approaching 10% several months ago, then that pointed towards a significant mismatch between folks that had illness and folks that were getting tested. That we needed to increase folks' access to testing and promote testing. So that's the other number that I really look at in terms of assessing prevalence. In terms of seroprevalence studies, which are studies that are done on blood samples to determine past infection. I know that those are underway in Washington State, and I'm awaiting those results because that helps us answer the question of how many folks have had COVID-19.
Okay, great. All right, let's go to our director's report. Go ahead, Shelley. Thank you, Dr. A.
Thank you so much, commissioners. Pull this up here. So I have some additional department items to share with you as we continue to operate programs in addition to our COVID-19 response and all the items that Dr. Abdelmalik just shared with you that support our mission for everyone to work together to achieve the highest level of health and well-being for everyone in our community. In our maternal child health program, 275 maternal child health visits were delivered to vulnerable nurse-family partnership families. In our developmental disabilities program, 10 new school to work participants were enrolled, and we're expecting at least 5 more to be enrolled before September. 5 out of 10 current school to work students have obtained employment at locations such as McDonald's, Alderbrook, Safeway, and Mod Pizza. Really excellent program. Our 7 new Job Foundation students are expecting 5 more to be enrolled by September. And Thurston County has had the largest number of completed Job Foundation reports submitted out of all participating counties in the state. So this program is off to a very successful start and very happy to be able to highlight a great program such as that. You heard from Sammy Berg, our Food and Environmental Services Program Supervisor here, and our FESS staff are wrapping up their kitchen and campus safety inspections at our county's more than 100,000 K through 12 schools. So this is a service that we provide each year, and these inspections provide kitchen facilities staff with feedback on areas of improvement. And this year, COVID-19 guidance was added in addition to a layer of technical assistance. So this is a excellent service that we're very proud to partner with our schools in an effort to improve indoor air quality, playground maintenance, and chemical storage and management in preparation for the upcoming school year, as well as operating our summer safety programs. Dr. Abdelmalik reported a little bit about our beach programs, and I wanted to follow up from a previous advisory that we sent out regarding our Kennydale, Thurston County Beach water quality program. So our environmental health staff monitor water quality at the Kennydale Beach Park, which is operated by Thurston County Parks during the summer. This program started in 2019 with special funding that was allocated by the Board of County Commissioners in the 2019 budget year. Samples collected on June 22nd, had levels of fecal coliform bacteria and E. coli that greatly exceeded the standards for water recreation facilities. As a result, we issued a swimming advisory because, as you heard in the water safety presentation, we definitely don't want people to be swimming in water that is not safe for kids and others. Parks and Recreation posted signs to warn people not to swim at the beach, so be sure to look out for that throughout the summer as this does occur. Staff took additional water samples in late June on the 24th and 25th to determine if the swimming advisory could be lifted. And our lab staff analyzed samples over the weekend to facilitate this work. And good news that the water quality improved. All samples were less than the water quality standard of 100 organisms per 100 milliliters. And that swimming advisory was lifted just before we had that hottest weekend on record. So our environmental health staff will continue to investigate the source of this pollution. As we stated in an agenda setting session, we do not know what the contamination source is, but we continue to monitor that beach for safety and encourage all residents that are enjoying our local swimming beaches to be sure to look ahead on our Thurston County Public Health and Social Services website or Thurston County website and posted signs to make sure that before you and your children enter our local beaches, that the water is safe. Our opioid response program has also been quite busy this summer. We are pleased that our overdose education and naloxone rescue kit trainings were provided to the Lacey Thurston County Food Bank and our public health social services vaccine clinic teams. As a result of that training, the very next day, our COVID-19 mobile vaccine team had the unfortunate opportunity to administer naloxone in an emergency where a person was unconscious and needed to be administered naloxone. Fortunately, our team carries naloxone, was ready to deploy that, and was able to save a life. We're very proud of our team, very happy that our vaccine teams do carry naloxone in addition to COVID-19 vaccines. And our vital records team has also been busy. Wanted to remind people that they can get birth and death certificates at our Thurston County Public Health and Social Services office on 412 Lilly Road. We are resuming back to our normal office hours, and people can also check out our services online and receive virtual services online as well as in-person services. And we administered 443 birth certificates and 847 death certificates in the last month alone. So our team is very, very busy. We have an incredible, incredible team of dedicated public health and social services staff that work hard every day to keep our Thurston County community safe and healthy. And with that, I will answer any questions that you may have today.
Commissioner?
No questions, but just thank you, Shelley, to you and your team for keeping us all safe.
Thank you so much, Commissioner Edwards.
Commissioner Mejia?
No questions. Thank you.
Okay, I don't think I do either. Acting County Manager Cummings? No question. All right. I guess we're done then. Thank you, Dr. A, Shelley. Thank you to the board. 5:13, we're adjourned. Thank you.
Thank you so much.